Anterior cruciate ligament, the road to recovery. How many of you know what it means to have an ACL tear? How many of you have ever experienced or know someone who has had an ACL tear? ACL tear, which is short for anterior cruciate ligament, is a very common injury in the sports world. It is something that many athletes have to deal with, and most of them are not very educated with it. This injury seems to be occurring more frequently nowadays. I am a student athlete who has gone through this injury twice, and not only that, my dad and my younger sister have also been through this same injury. Today, I will educate you about the ACL tears, its treatment and recovery, and getting back to sports. ACL tear. What is it? According to Mayo Clinic, an ACL injury is a tear or sprain of the anterior cruciate ligament, which is one of the major ligaments in your knee. On March 24th, OrthoInfo stated one of the most common knee injuries is an anterior cruciate ligament sprain or tear. These type of injuries most commonly occur during sports that involve sudden stops or changes in direction, jumping and landing. Some of these sports where this most commonly occurs are basketball, soccer, and football. What is it like when it happens? When an ACL injury occurs, many people may hear or feel a pop in their knee. Then the knee may swell, which will cause it to feel unstable and become too painful to bear any weight on it. Depending on the severity of the ACL injury, some people may still be able to bear weight on it and walk, but others may need treatment. Different causes. There are many different causes to this type of injury. The ACL, which is one of the two ligaments that cross in the middle of the knee, connects your thigh bone to your shin bone and helps stabilizes your knee. One of the causes is landing awkwardly from a jump. For instance, in basketball, when you jump up and grab a rebound, you may land weird, which can cause your knee to buckle. Another one is stopping suddenly. Once in motion, if stopped abruptly, it can result in an ACL tear. Genetics. As you may not know, studies have shown that an anterior cruciate ligament, also known as ACL, has been followed by genetic association. According to sports medicine, studies in recent years have suggested that genetic predisposition is an important factor in its etiology. ACL treatment and recovery. ACL tears in men and women. Women typically have a higher risk of sustaining an ACL injury than men. Statistics show that women are 2 to 4 times more likely to tear their ACL. Some reasons for this increased risk are the differences in anatomy, the training, and the activity experience. According to eMedicine Health, women have a wider pelvis than men to accommodate childbearing, and this can cause an increased angle where the femur meets the tibia at the knee joint. So, therefore, a wider angle increases the stress of an ACL, increasing the risk of surgery. Surgery. When surgery is involved, the ligament is not repaired, but it is constructed. On September 20th, 2018, the HealthWise staff stated that ACL surgeries are done by orthopedic surgeons. A variety of techniques can be used when it comes to this particular surgery. These techniques include the ligament may be taken from the patella tendon, which is the tendon that attaches the quadricep muscles to the tibia. In fact, when I tore my ACL, I had the patella tendon done, but there is also the part of the hamstring tendon in the back of the knee, or it may be a donor or cadaver graft. With that being said, each of these options has its advantages and disadvantages, and what may work for one person may not necessarily be the best option for someone else. Physical therapy. Physical therapists are an important part in the treatment for this type of injury. They also are usually involved in the planning part before and after surgery. With this type of injury, recovery time can be months, and most often, rehabilitation and physical therapy are always required after the ACL reconstruction. Getting back into sports, exercise. There are many different exercises you can do for after an ACL surgery. The better your knee recovers, the better exercises you will be able to do in the future. Because I have been through this experience twice, I know all the do's and don'ts. The most common one after the surgery is getting the range of motion back. This is something that you want to get back as soon as possible. The better the range of motion is, the better exercises and recovery will be for you to return back to the sport. Bracing. When returning back to the sport that you play after an ACL tear, most doctors do recommend wearing a knee brace. Although bracing is not absolutely necessary when returning to a sport, because of the injury, the athlete may not feel comfortable enough to play without a knee brace. So the knee brace gives good stability, making the athlete feel more comfortable. According to Better Braces, the Donjo Armor knee brace with force point hinge is the most supportive ACL brace. This type of brace reduces strain on your ACL by applying pressure to the inside and outside of your femur and tibia to prevent them from moving beyond the normal range of motion. Dedication. With an injury like this, it takes a lot of hard work to get to where you fully need to be. According to Very Health, high level athletes often come back from injury better than before their procedure. For most people, it takes at least 9 to 12 months. It is a test of endurance that takes dedication and perseverance. ACL tears is something that is very common in the athletic world. It can put a long pause in your sports career. With the proper equipment and treatment, you can heal from this type of injury and get right back out to what you love to do. Thank you. And here are my references.